and welcome to Nurse Table Talk. I'm Nurse Julie, and today Kathy and I...
Hi everybody, Kathy here.
We're going to talk about kidney basics, and by the end of today's video, you'll have a better understanding of why our kidneys are so important. So let's get started.
Okay.
So we'll start off by, the functions that our kidneys do, and they do a lot of things actually. They filter our waste and remove toxic substances like medications. They help regulate our blood pressure. They help create hormones that help produce red blood cells. They help keep our bones healthy. And those are just a few things that they do. So we can't live without them, right?
Yeah.
So, and when they're working right, everything's good. But if you start to have kidney failure, your kidneys are no longer working effectively. And without the proper treatment, it can be fatal. And so Kathy's going to let you know what chronic kidney disease is.
Mm-hmm. So you don't go from perfectly fine, healthy kidneys to kidney failure. There's a long stage in the middle called chronic kidney disease. And over 200,000 Americans have kidney failure right now. And it doesn't necessarily mean that you're ever going to go into kidney failure. It just means that your kidneys are working harder than they're supposed to. Mm-hmm. The symptoms develop slowly, again, don't necessarily lead to failure, but for 200,000 people a year, they do get a diagnosis of kidney failure. So you're diagnosed through your blood work, and they're looking specifically at a value called your GFR, your glomerular filtration rate. And I'm sure I didn't say it right, but that's what it stands for, GFR. And so people are in different levels or stages of kidney failure when they get a diagnosis of kidney failure. And because it doesn't happen overnight and it's a long process, it's deemed chronic. So chronic kidney failure has 5 different stages. When a person gets to stage 4, and into stage 5, that's when we kind of turn the definition from chronic kidney disease into kidney failure. So that's that piece.
Right. Mm-hmm. And, a lot of times when I would talk to people, Kathy, about their kidney problems, or all of a sudden they were super surprised because they ended up in stage 4 and didn't even know they passed stage 1 through 3 because their doctors didn't tell them. Correct. So I always encouraged people to ask their doctors about their lab values. When they get your labs done, hey, how are my kidneys functioning? Yes. Do I have anything to be concerned about? Because that can be managed, like you and I were talking earlier, through diet. And yes. A lot of times the nephrologist office, who is a specialist with kidneys, yes. We have usually staff members, either dietitians or renal dietary specialists in their office that helps determine from their lab values maybe what some of their things that they should be aware of when they're consuming meals, like potassium and calcium. And
yeah, it really is. And Julie, you're the dietitian, not me, but a lot of chronic kidney disease for a long time can be managed outside of a hospital or a doctor's office setting. So there's a lot that our patients can do to take care of themselves, and we should probably talk about that at some point. Right. But just introducing what chronic kidney disease is and how it affects people, I think, is really important information. Right. For sure.
And on our website, Nurse Table Talk website, we have a resource page, and we have put National Kidney Foundation on there, DaVita's on there, and I always mess up this. Fresenius is another kidney dialysis center, and they have on their websites wonderful information specific to kidneys. Yes. So if you have any concerns, always talk to your primary care, your nephrologist, your kidney specialist, or do some research on your own and become aware of what you can do to help prevent kidney problems.
Definitely.
So anyway, thanks for watching, and we'll see you next time.
Bye now.
Bye.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.